The hips lead the way in the golf swing. If you want to have that fluid, effortless swing that creates the easy power, you need your hips to lead the way. That's also going to be the way to protect your joints, because if you have that fluid, effortless swing, your joints are going to be in better positions to accept force, and your back is going to be in a better position. So that means that hip alignment is pretty important. If your hips are misaligned, it makes it tougher to rotate, and also puts your spine in a poor position because your spine is on your pelvis. So let's talk about certain types of hip misalignment. And I want to talk about one today that's very common. Now, see the way I'm standing? I'm standing on my right side. This is a pretty common way for people to stand. Now, when I'm standing on my right side, my right pelvis is rotated back a little bit, and my left is rotated right a little bit, and my hips are oriented that way. So it looks like this. Now, as I go to my left side and walk, let's say, that position is reversed. So that's a normal gait pattern. But what happens is a lot of people are stuck in this position where this pelvis is rotated back, this pelvis is rotated forward, relatively speaking to each other, and their hip is oriented towards the right. Now that's because a lot of us stand like this. Our bodies adapt to habitual positions and movement. Also, believe it or not, because we're asymmetrical inside, we breathe into the right side a little bit more. So to exaggerate it, when we're breathing, we take a deep breath in, and we're kind of very subtly rotating to that side. But a normal gait pattern should have your hip moving like this. But a lot of us are stuck here. Now, what happens is when you're stuck in this position or this pattern, when you move to the left side, you're still stuck here. So in that case, because your pelvis isn't moving and rotating correctly, when you're stuck here, this foot now is rotated that way. So let me go square to you. Okay, so if I'm stuck like this, this foot would be rotated that way. So in order to stand straight, I have to turn this foot straight. Now what does that do? That externally rotates your femur into your hip. But because your pelvis is in this orientation, when you externally rotate that foot, you're putting a lot of pressure on the hip rotators. So the posterior capsule of your hip becomes tight and overworked, and the front, the anterior part of your hip capsule, the ligaments and tendons get stretched out, and that puts a lot of instability in your hip. But from a golfing point of view, if you are stuck in this position, that means that you are constantly having to externally rotate this femur, and the posterior hip capsule becomes very tight. Now, let's talk about the golf swing. We need internal rotation as we come into impact. Through the downswing and into impact, this hip needs to internally rotate. But if we are in this orientation and the posterior, the rear part of the hip capsule is very tight, and it makes it really tough to internally rotate, now we're stuck and we can't do it. Okay, so let's compensate, right? We talk about possibly compensating your stance. So if you open up your front foot a little bit, what have you just done? Well, so don't forget, this is the orientation. Now I'm compensating, so I'm going to open up my front foot. I'm going to put that into even more external rotation. So now if this is the femur on that capsule, and these are the ligaments, now I've rotated this even more, and I've stretched out the ligaments and tendons and soft tissue on the front side of my hip capsule even more. So I've put a lot of instability in this hip. The hip that needs to absorb all that force in the downswing. Because when you're coming into impact, you're driving this foot forcefully into the ground. This hip is rotating and extending, into internal rotation, extending forcefully with all this force coming into impact and through release on a destabilized joint. So that's one way that your pelvic position, your hip alignment or your hip misalignment can actually cause injury and wreak havoc with your golf swing, because you're just not going to be able to get into this position that easily, and that's going to create the swing flaws that we talk about. For instance, if you can't complete the rotation, if you can't make your hips lead the way in the golf swing, if you get stuck here, then you're going to flip and cast, and that's never a good thing. You're going to lose power, you're going to lose control. So hip alignment is crucially important. Hips lead the way in the golf swing. That hip position, hip alignment that we just talked about is pretty common, and it can cause problems for your hips in terms of destabilizing the hip. When you put force into a destabilized joint, you're going to have an issue. So if you found this helpful, we'd love you to subscribe to our channel and give us a thumbs up, because we want to get our message out to as many people as possible about improving movement quality. So tell all your golfer friends, and you know what? It's not just really for golfers. A lot of people can benefit from improving their movement quality. So thanks for watching.